Hello, my name is Magdalena Bujalski and this is my cancer journey. In today's video, I wanted to go over in detail how exactly I got diagnosed. So what tests I had done and why I had those tests done, just for people who are wondering A, what the procedure is when you get diagnosed with cancer. Obviously it's different for everybody. And B, if you're curious about all these different tests that you keep hearing the names of but don't actually know what they do. The different tests that I had done were kind of like different pieces of a puzzle that were put together, and then in the end we're able to determine exactly what specific type of lymphoma, what stage it was at, and what the course of treatment most likely would be. Initially, when I had gone to the walk-in clinic, I got a blood test and an x-ray. The blood test came back that my white blood cell count was really high. The x-ray came back that there was some sort of an infection in my chest, which is why they thought that I had either bronchitis or pneumonia at first. Essentially, had it not been for the walk-in doctor who suggested that I go get another x-ray done after I was done the antibiotics that she prescribed me, I probably would have never known till this day that I had a lymphoma, because the cough went away and the swelling of my arm went down. But since the second x-ray showed some abnormalities, I had a CT scan. A CT scan, which stands for computerized tomography scan, is basically an in-depth x-ray that takes a bunch of pictures from different angles, and then through a computer they're able to put them all together and create a small slideshow / video, which gives them more of an in-depth look on what is going on inside of you. You do have to fast for about 4 hours, which doesn't seem like a long time, but if you're a snacker and you get very hangry, like me, 4 hours is a very long time. Okay, so first things first, you change into a gown and a robe, because you're not allowed to have any metal on your body. You sit down in a chair and you get an IV of something called a contrast. So the contrast is essentially a special dye that they will inject into you at the end of your CT scan in order to kind of let them differentiate images and see things a little bit differently, more highlighted. For me, it was just a needle in my arm with a tube and a syringe with the contrast in it taped to my arm. Another thing about CT scans is usually they're very specialized, like they only focus on one area. So this CT scan was just focused on my chest. Once you're all ready to go, you go into a room and see this machine that looks like a donut, especially if you're hungry, and you lie down on a bed. They strap you in so you don't move around because you need to stay absolutely still during this test. And then they just tell you to follow the instructions in the machine. The donut kind of like rotates around you while the bed kind of like moves in and out. It only takes about 15 to 20 minutes and you're all done. For me, I got the contrast in the last 5 minutes of the test. So the nurse came in and she just pushed the syringe, like I said, and it went in. For anyone who's had contrast from a CT scan, you know the side effects. You get a hot flash basically from head to toe. It's like instantaneous like heat. And then you feel like you pee your pants. Like legitimately, you feel like you have just emptied your entire bladder out. Luckily, that feeling passes within seconds. The contrast, you kind of just pee out eventually, so they tell you to drink lots of fluids for the next day or two. I did have a second CT scan that was done a few weeks later after I had had my biopsy, and this scan was focused on my neck and my abdomens, just because they weren't quite sure if it was lymphoma yet, but because lymphoma tends to grow and spread very quickly. If it were to spread, it would have spread either up into my neck or down into my abdomen. I think over the last probably 2 months, I have had more blood tests done than I have had in my entire life prior to these last 2 months. I think every single doctor and specialist that I've gone to see, which there have been quite a few, has sent me for separate blood testing. Next after that was my biopsy. A biopsy is a procedure where they remove either fluid or a small piece of tissue to send it to a pathologist for specific testing. And this is the only way that they would be able to find out whether I actually had cancer or not, and exactly what kind of cancer I had. Because my diagnosis was so sudden, my biopsy was considered an emergency surgery, and I had to be squeezed into the operating room whenever they had time. We were kind of on call, on standby for a few days. They weren't able actually to tell me how long the surgery would be, just because they really did not know what to expect with this tumor. They told us that the procedure could be anywhere from an hour to 2.5, 3 hours, just depending on how invasive they need to be and how hard it is to get the proper amount of tissue that they need. Their plan going in was to go under my second rib and hopefully be able to reach the tumor from there and cut off a piece. However, they did have my permission to go in here and under my rib. In the event that they weren't able to reach it from the top, they would try going in from the bottom. Luckily, the biopsy went very well. It was only an hour and a half from start to finish. They were able to get in from the top. I thought recovery would be quick. However, I would say I was probably out of commission for 2 weeks in total. The effects that I had during my recovery were that for the first few days, it really hurt to breathe. I think just because so many things were poked around in there. I felt very weak and very lightheaded. And I had severe back pain. And the reason I think I had severe back pain was because I was really trying to protect this area. Another thing that I developed right after my surgery was night sweats. Just like absolutely terrible night sweats, which I later found out is actually a side effect of lymphoma. And I also had a very bad cough. So it has been exactly a month and 2 days since my biopsy. My chest was very swollen and it still is a little bit. I'll show you my scar here. And unfortunately, it's a little bigger than I would have hoped for, but scars are badass, right? About 2.5 weeks later, I was diagnosed. So I just got diagnosed with lymphoma, and then my car got towed. So now that we got the boo-boo situation figured out, we gotta figure out what to do to make the boo-boo go away. 3 days after my diagnosis, I went for a MUGA scan. A MUGA scan stands for Multi-Gated Acquisition Scan. It is a nuclear medicine imaging test, and it basically measures your heart health. This is a very common test for cancer patients. I had it for 2 reasons. One was to see if my body would be able to handle chemotherapy, because chemotherapy does have effects on your heart. And the second reason why I had it was because where my tumor is, it is blocking veins that are pumping blood into the left side of my body. They weren't sure whether it was also affecting the veins into my heart. I got this radioactive material injected into my veins. After that, I had to sit and wait for 30 minutes to let this injection kind of travel through my entire body. Once the 30 minutes had passed, I went into a room and it looked again like a CT machine, kind of a big tube. They made me lay down on a table. They attached a bunch of different like pads to me. So I think I had one on each of my hips and then on my chest. And then they also give you a second injection of radioactive material. And then you basically lay still for about 30 minutes. This machine revolves around you, this big panel, and takes pictures of your heart minutes at a time in different angles. That part of the scan took about probably 30 minutes. And just like with the CT scan, you pee out all of the radioactive material eventually. Last was my PET scan. So that was the last test that I needed to have done before I was able to start chemotherapy treatment. PET scan stands for positron emission tomography scan. And for this one, you have to fast for 6 hours. Even worse. How this test goes is at first they check your blood sugar level. So like they do with diabetes, they prick your finger and they check, and then they get you to change into a gown. You look like this outfit. And after that, they put you in this really comfortable chair with your legs up, and they inject this radioactive sugar mixed with saline into your veins, and you sit there for an hour while the whole concoction travels through your body. The reason that they inject slightly radioactive sugar is because cancer loves sugar. So cancer cells absorb sugar, and on the PET scan, it lights up, basically highlighting where cancer cells are in my body. Another day, another test, another table, another big tube to go into. And this scan measured from my brain down to the bottom of my pelvis. After all these tests were done, the doctors had all the information that they needed, and I was cleared to start my chemotherapy treatment. Thank you so much for watching this video, and thank you so much for following my cancer journey. Unfortunately, cancer in young adults is very real, so please take care of yourselves and know your body. Till next time.